Okay, everybody, it's 12:30. Thank you so much for joining the Dialysis Patient Citizens Education Center's Instagram Live, and we welcome you into the room. And we have a special guest today. Her name is Fanny Sung Whalen, and she is a registered dietitian based in Nashville, Tennessee. She also serves on our advisory council, and for all of those great recipes that you see every month, they're at the courtesy of Fanny. And we thank you so much for that. Um, Fanny has knowledge about dietitian tips for pre dialysis patients, dialysis patients, post dialysis patients, and of course, transplant patients. So, Fanny, today we're going to the name of it is What Are You Eating? Because we know that you are what you eat. And labs are so important with all patients, especially renal patients. And it can tell how much phosphorus is in our system, how much potassium is in our system, on and on and on. And that's how doctors treat patients as well as dietitians know what they should eat. So let's talk a little bit about phosphorus. We know that phosphorus can be deadly for renal patients. So they must concentrate on what they eat. So what kind of tips do you have to limit phosphorus?
Well, I would say first and foremost to discuss with your healthcare provider if that is something that you even need to limit, depending on where you are in your journey. If you're transplanted, you might not need to limit that at all. If you're early, if your earliest stages of kidney disease, that might not be as big of a concern.
Mm-hmm.
So that's what I would say. First and foremost, talk to your healthcare provider. Make sure you understand what your labs look like from month to month, or when you have to get them drawn. There are certainly, I'll just dive right in. There's certainly a lot of, as we're well into the summer months. There's a lot of, eating out, eating with family, barbecuing, grilling, those kinds of gatherings. And so there are definitely alternatives that we can choose, to some of those typical grilling foods, which is kind of what I focused on with my notes, that, can offer some relief, a decrease in phosphorus.
Mm-hmm.
Do you want me to just go right into it, Nancy?
Absolutely,
Okay.
absolutely.
Okay. Just keeping an open mind about the foods that you're choosing, instead of, for instance, if you're at a barbecue or a grill out, feeding a big crowd can be difficult and very expensive. So a lot of times we'll see at these kinds of big gatherings that you might have things like hot dogs, bratwurst, sausages, big packs of, things that are inexpensive meats. And so keeping in mind that those kinds of foods that are highly processed are more than likely going to have a lot of phosphorus additives.
Mm-hmm.
So keeping in mind, leaning more towards fresh meats and poultry, grilling your own. You can even, one thing that I always suggest to folks with diet restrictions is that when you go to these events, a lot of times these events are potluck style events.
Mm-hmm.
Everyone
Mm-hmm.
brings a dish. Make sure to bring something that you can eat so that okay, this is safe for me to eat. If there's nothing else that is safe for me to eat, at least I know I can eat what I brought.
Mm-hmm.
So,
Mm-hmm.
and talking with the host and the hostess, what else is going to be there? What can I bring? So you can kind
Mm-hmm.
of plan for, there's going to be hot dogs there. I can't really eat hot dogs. Maybe I'll pad out some fresh hamburgers. You can use turkey meat. You can use ground chicken meat instead of beef. You can get, big packs of lean poultry from, Costco and Sam's and places like that. Marinating those with very low sodium seasoning, making sure you're not using a lot of added salt. Or bottled marinades can be very high sodium, so you'll want to watch that as well, and high
Mm-hmm.
phosphorus as well. Using fresh herbs, fresh or dried herbs, those kinds of seasonings can be really good for flavoring meats without adding that extra salt and phosphorus. Seafood is a great choice, especially for our early stages where we're wanting to sort of limit those heavy proteins. Seafood, we want to kind of focus more on plant-based proteins. Seafood and fish, those things can kind of fall into that category of being less taxing on the kidney
Mm-hmm.
function.
Mm-hmm.
Veggie burgers are a great choice. You'll want to be careful when you're looking at veggie burgers, though, because some of them are very high in sodium. So you'll want to be sure to be looking at the label. But the great thing about veggie burgers is there is a nutrition label that you can look at. So you can
Mm-hmm.
get all of the information there and the ingredients list there. So you can see, and there are now probably tens and tens of different brands and styles and varieties of veggie burgers. So there's a lot to choose from.
Mm-hmm.
I always tell our patients, not, I'm here in the South, and so a lot of our patients don't know. It's more of a traditional kind of meat and three type of meals. But I always tell them not to shy away from tofu. I know that it can be intimidating because if you don't know how to cook it, you're like, oh, it doesn't taste like anything. What am I supposed to do? But there are so many recipes online on how to use tofu instead of as a meat alternative. It doesn't have any taste to it, so it will pick up on whatever taste you're adding to it.
Mm-hmm.
So that, and there, if you get into tofu, if that's something that you're interested in doing, just be aware that there are different firmness levels of tofu. There's silken, there's soft, there's firm, and then there's extra firm. And if you're wanting to use it on the grill where it's going to need to kind of hold up, you'll want to use that extra firm texture. And what's great about the extra firm texture is that once the liquid is pressed out of it, it is kind of like a sponge. It will soak up whatever seasoning you put on there.
Mm-hmm.
So just make sure you're not using low sodium seasonings. So tofu can be a really great option. I
That's an
love
acquired taste, though, right, Penny?
it can be an acquired taste. That's true, and maybe an acquired texture, kind of.
Uh-huh.
That's true. But don't be afraid of it. It's not expensive. So if you ruin it, who cares? You're out $2. It's not a big deal.
Right.
Yeah, and so and it can even be tofu can even be crumbled if you use the extra firm and seasoned and used as taco filling
Mm-hmm.
or like enchilada filling, fajita filling. So there's a lot of different uses for tofu.
Mm-hmm.
So, and nowadays with the internet, you can find any recipe you're looking
Mm-hmm.
for online. You
Mm-hmm.
probably find hundreds of, the same recipe for, anything. I love kebabs for our dialysis patients because they can be customized. You can kind of make your own kebab, like kind of, you just want a veggie kebab, or you want a couple of things of meat or some shrimp on it, but you don't want too much. That can be a really great kind of flavorful and filling sort of menu item. And the vegetables, you'll want to make sure if you're watching out for your potassium to choose those lower potassium foods. Squashes, zucchinis, eggplants, onions, bell peppers. You can put a couple of cherry tomatoes on there. They're so small. Mushrooms are great. Grilled pineapple is really
Mm-hmm.
delicious. It's up on the grill. Sometimes I've even seen people grill peaches on the grill, and that's a really delicious kind of, can be sort of incorporated into the dessert part of your meal, or even the main part of your meal. One thing I was thinking about that I don't think a lot of people think about often too is vegetable steaks. I don't know if you've ever heard of that, Nancy.
I have, yeah.
Yeah,
I don't
you
think
can.
there's too many foods I haven't.
Yeah, you can cut if you cut, zucchini. A lot of times it's zucchini, squash, eggplant is a really good choice. Cut it thick,
Mm-hmm.
or portobello mushrooms. That is a really popular one, and even cauliflower. If
Mm-hmm.
you take the head of a cauliflower, you can probably get about 4 cauliflower steaks out of one head of cauliflower because the ends are going to just fall off. You'll want to keep that middle piece so the cauliflower stays intact. And you can season that and grill that, and it's actually quite delicious. So that is a really good alternative.
Yes, I agree with you because I know people that actually make sandwiches out of the mushrooms instead of
Yeah.
using bread, and which is
Yes.
a good idea. And you're cutting down on your phosphorus, the carbs, and everything else. So that's a great idea.
Yes. Yes.
Well, Fanny, let's talk about fluid intake. Summer is officially here. And I'm going to even write an article about that for our e-news next month. But one of the biggest challenges with being on dialysis is limiting your fluid intake. And I know I suffered with it, and I'm sure many other people do as well. Um, Drinking in the summer, everybody gets thirsty, whether you have a disease or not.
Yeah.
What are
Yes.
some of the tips you can give to quench your thirst?
Mhm. First and foremost, I will say if you're diabetic, to make sure that your blood sugars are staying within normal range. When the blood sugars get very high, that can increase that thirst. Your body is trying to wash out that blood sugar because it doesn't understand. It's not being taken up by the cells the way it's supposed to. So
Mhm.
making sure your blood sugars are under control is something that we don't often think about, in terms of our patients don't often think about, because they just think, well, I'm so thirsty, I must be hot, or, but there are different factors that can play into how thirsty you become. So
Mhm.
blood sugars, I would say, is really important. And, a lot of our, folks that we see are diabetic. Watching that sodium intake too. The more sodium that you intake, the thirstier you're going to become. Again, the body is trying to flush it out. So
Mhm.
you'll want to make sure to watch that sodium intake, and also making sure when I talk about sodium intake that you're not just thinking about salt. You're actually thinking about sodium content in foods.
Mhm.
So, for instance, bread. Bread doesn't necessarily taste very salty to us, but it does have a sodium
Mhm.
content. So
Mhm.
making sure that you're looking at those labels and choosing those low sodium options, thinking about those marinades that we talked about, the seasoning, even if you're using butter, salted butter is very high sodium. And if you're like me, I love butter, and it can add a lot of sodium on top of whatever you're putting it on, plus all those other ingredients that you're adding to it.
Mhm.
So blood sugar and sodium intake, I would definitely want everyone to sort of be aware of that, and the importance and the role that it plays and how it makes us thirsty. In terms
Mhm.
of some tips for watching fluid intake, if it is very, I mean, I'm here in the South, but I know you guys on the East Coast, it is hot.
Mhm.
We're pushing 100 degrees with 100 and, single digit heat indexes down here.
Mhm.
It's very
Mhm.
humid. If it's the hottest part of the day, which is typically, we say, between 10 or 11 a.m. to about 3 or 4 p.m.,
Mhm.
and it's going to be really hot, stay indoors. Try and
Yes.
find an air conditioned, stay in the
Mhm.
shade, stay indoors, and that can help to reduce that thirst. And you don't want to risk getting heat stroke too. So that's important, especially for some of
Mhm.
our older folks.
Mhm.
But in terms of tips for quenching thirst without having to guzzle drinking, there are certain tips that we advise our patients. You can freeze certain fruits, are really great frozen, like grapes. Pineapples are really good frozen. That can kind of help to quench thirst. One of the tips that we offer our patients is to freeze lemon wedges. The tartness of the lemon. So it's anytime there's acidity in the mouth, your body wants to produce more saliva to rinse it out because it's protecting your dental health. So if you can suck on a little bit of lemon wedge or lime wedge or something like that, not a lot and not often, because you don't want to damage your dental health either.
Right. Right.
But that can help, produce more saliva in the mouth. If that's something that you're not wanting to do, it's too tart for you. There are, sugar-free if you're diabetic, hard peppermint, lifesaver, like peppermint type candies, chewing gum. Typically, those minty flavors can really help sort of increase that saliva in the mouth, and that can
Mhm.
help sort of quench some thirst. a,
Mhm.
a mouth that's filled with bacteria is also going to be a thirstier mouth. So sometimes it helps just to brush your teeth in the middle of the day. You know, I've heard some patients will say, well, I don't want to drink too much fluid, so I'll eat ice instead. This can be a very smart tactic, but you have to be sure you're not eating too much ice, because ice
That's
can melt
correct.
into fluid. And
Mhm.
so one of the things, if you're measuring your fluid, we will take, everyone, I use this cup at work for my drinking.
Mhm.
And every day I use the same cup. A lot of times that's what we do at home. We have the same kind of cups that we use. Take one of those cups, fill it up with the ice, put it in the microwave and melt it, and then measure it. So okay,
Mhm.
I've had one, cup of ice today. What does that mean in terms of my fluid? And then you can keep a mental track. Okay, I had one already. That's enough. And you can kind of keep a mental track of that fluid intake.
Mhm. Mhm. And one of the things too that we have to take into account, I know what I did. I used to drink 4 8-ounce bottles of water. I used to call them the shorties.
Yes.
But we also have to take into account that we have to use that same count to take our medicine as well. A lot of people think that they can drink, say, if you're limited to 32 ounces, that you can also drink more with your medicine. But it's just all about your new normal and the journey that you're on, and to concentrate on what you can eat and what you cannot eat, because you don't
Yes.
want to be miserable. And so
Yes.
many people, like I know a particular patient that too much salt was in their diet. So the doctor said no more salt. And that person lost so much weight because they were so busy concentrating on what they couldn't eat and that they couldn't season their food with salt. And there are
Oh,
so many other seasonings that you can use, but if you don't know, you just don't know. And that's one of
yes.
the reasons why we have Instagram lives like this, just to make the journey that you're on as easy as possible, because you don't know unless you've been there. And I can
Yes.
talk
That's
about it because I've been there,
absolutely
and it's not easy.
Nancy. Yes.
It's not easy, but
It's
it
not
is
easy.
doable. It's doable,
Yes.
and
I'm
you're
glad
still.
you mentioned that too, Nancy, about the medication, the water you drink with your medication,
Hmm.
because I'm glad you mentioned that. That reminds me to also mention, if you're eating popsicles, if you're eating Jello cups, if you're
Hmm.
eating ice cream, a soup, all of those things will also count as fluid.
Yes,
So,
that's right. That's
yeah,
exactly right. And the bad part about the fluid buildup is that you don't feel good,
right.
and you're not going to get a good dialysis.
Yeah.
And if you don't leave at your dry weight, you're carrying more weight until you come again, and then it just gets out of control. So the
Yes.
main thing is to, pay attention to the tips to help
Yeah.
you curb your fluid intake. Let's talk about transplant patients now. Everybody thinks you're home free because you got a kidney. I mean, I know about that too. And I know that you have to do that diet as well. So let's talk about a healthy diet for a transplant patient. And right away, I think everybody knows that we have to stay away from pomegranate and grapefruit. So what
Right.
other
Recommendation.
tips can you give?
Sure. So once a patient is transplanted, like you said, Nancy, it doesn't mean that you're, 100% cured, but it does mean that you're cured of dialysis, but you're now back in that early stages of kidney failure. You kind of fall into that range.
Hmm.
So a lot of times, a big part of the transplant diet that we recommend goes back to those stage 1 and stage 2 CKD kind of diet recommendations. So
Hmm.
we do kind of push more for that plant-based protein diet, not making sure we're not taxing that kidney too much with those heavy, inflammatory proteins.
Hmm.
Of course, taking your medication as prescribed, because you don't want to lose that transplant. That is number one. And making sure that you're following up with your transplant team, once they clear you for, they want to see you every month for the first little while. And then once you're kind of stable, they're all right, you can come in quarterly. And then eventually you can come in twice a year. And then eventually you might be able to just come in once a year if you're very stable at that point. And just making sure to follow your transplant team's guidelines in terms of how often they want to see you, because when they see you, they're drawing blood and they're looking at where your levels are and making sure that you're on the right path.
Hmm.
So, making sure I always, it's one diet doesn't fit all. It's not a one size fits all kind of situation. For me, I always want to know, well, let me see what your labs look like so I know what to focus on,
Mm-hmm.
and then talk to you about what is a typical diet for you. Because if you are typically used to eating one way and I tell you, oh, you can't eat that way at all anymore, you need to eat this new way, you're going to be like, I don't want those foods. I don't know how to prepare those foods. I don't know anything about those things. Just like my tofu spiel. You're like, I don't know anything about tofu. I don't want to eat that. So, finding out where the patient is. So for me, the healthcare team is going to be very, very important in that role. And one thing I will say that is one of our biggest challenges with transplant diet is the way that the medication can cause diabetes to occur and having to make adjustments for that. And unfortunately, it doesn't happen to all of our patients that are on some of those medicines, but some of them do end up in that position. And unfortunately, it's just one of the consequences of having that kidney transplant, which you want to have the kidney transplant, but now you have to, now I need to figure out these new guidelines to fit into my diet. So, a lot is dependent on those types of things as well. But I would say first and foremost, reverting back to those kind of plant-based diet, low inflammatory diet, kind of protein foods. And then for everything else in terms of phosphorus and potassium, seeing where your labs are at will be important. But a lot of times right away when we see transplant patients, immediate after transplant, we see a significant drop in phosphorus levels. They have to get phosphorus supplements, potassium supplements, to kind of get their bodies used to that.
Right. Well, let's talk about fluids. The mind is a terrible thing to waste. And I say that because on dialysis, you're limited to your fluid intake. On transplant, you can drink, 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 drink. And when somebody tells you you can do that, the mind says, oh, I can't drink that much water. When you were on dialysis, you wish that you could have drank that much water. So
Yeah.
that's another thing I think that a lot of transplant patients, I understand, become dehydrated because they're not drinking what they should drink. And then there's different medicines that are a side effect of dehydration. So, what are some of the things that you can tell just to remind a transplant patient that they have to drink,
Oh,
drink, 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 drink?
that is, I'm not sure that I have the best answer for that. I think it's a learning process. Same goes the other way. We'll get patients into our PD program that were on chemo for years and years, and their potassiums get, dangerously low because they've been told for years and years they have to restrict their potassium. And now they're here, and we're like, no, you need to eat more potassium. And they're, oh my gosh, I haven't eaten a banana in 7 years. I've had patients tell me that before because they've been for so long. So that is definitely a work in process. I think that my primary goal is to educate the patient and make sure they understand why it's important for them to drink. We want to keep that kidney working. We don't want to dehydrate that kidney. We want to keep that urine output going. And so making sure they understand that and then giving them guidelines. A lot of folks, I don't know how much to drink. And we can say, like you were saying, a lot of our patients drink, bottled water. And so that's easy to keep up with, 6.9 ounces or the little 8-ounce ones, So we can kind of tell them, okay, every day your goal is to drink 5 of those or 6 of those. And then just line them up, in the morning or the night before. And that by the end of the day, you need to finish that many. So that can help them sort of get more used to.
Right.
And I think once they're able to trust that their bodies are working, their new kidney is working the way that it's meant to, once they're able to let go of that fear and they can trust that process, I think that really then puts them into a different place.
Yeah, I think so. I think Penny, I also know that one of your specialties is working with home dialysis patients, patients, on PD. How is their journey? Because they can eat a little more liberally, they can drink a little more liberally. What is your take on that?
So One thing that I noticed, I have a lot of thoughts on this, Nancy, I'll
I
say.
know it.
One
We
thing I
only got
noticed,
about 5 minutes.
okay, when patients come to us from hemo and they've been on hemo for a long time, one of the big selling points to come to PD is that the diet is more liberalized. And so in their minds, they think that, oh, I can eat so many things that I couldn't eat before. But that's not necessarily true. You can eat more potassium foods. We don't typically have to restrict our patients on potassium. Some of our patients have to. I have a patient that I just got off the phone with, which is why I was a couple of minutes late jumping on with you. But his potassium is so low, we're having to start him on potassium supplements, and he didn't pick them up last week. So I called him like, hey, we're midway through the week, right? Well, you need to get on these supplements. You're very low. And they don't understand that that's also just as dangerous as the high potassium.
Right.
So, that is a transition. The phosphorus restrictions are the same. And quite honestly, Nancy, the fluid restrictions, they are a little more liberal if the patient still has urine output. They can still drink up to their urine output and their ultrafiltrations, average ultrafiltrations. But once that urine output drops, it is very, very difficult to get them to a dry weight. We always say in home patients that a dry weight is really kind of a guessing game for home patients, whereas in center patients, you can just put the numbers in the machine, and it gets them to a point their dry weight. With PD, it is a bit of a guessing game. And some of our patients that we think are at their dry weight, they then go on to get a kidney. We had one patient who went on to get a kidney transplant and lost 30 pounds of fluid in the first 3 to 4 days.
Oh,
And we
I
always
understand.
thought he was
I
dry.
believe that. I believe that.
We did not know. Yeah.
Yeah, I know that can happen. Believe me.
Yeah. That fluid can hide.
It really
Yeah.
can. It really can, which is one of the reasons why dialysis patients should watch their fluid intake, because we both know that if you no longer void, that fluid has to go somewhere,
Yep.
and it's going to the heart.
Yes.
So people, and it's not to scare anybody. I just think when you know better, you do better, and that's
Yes.
not my saying, but it's the truth. And
Yes.
I think that we just have to remember this journey. It does not mean the end of your life. It just means the end of your kidney function. Well,
Correct.
I cannot tell you what a pleasure it's been to have you. We didn't rehearse. We just had an even flow, and you have been so helpful to the Education Center. I love the relationship that you have with us. Whatever I call on you, you're ready to do it, and you're all the way in Nashville, Tennessee, and we
I
just really
love being a part of the group, and I
well,
appreciate you all trusting me
well,
with what you do.
well, we love having you, really. We really do, Fanny. I don't see any questions for you today, so we must have answered everybody's question. And
Great.
I'm going to, I would just like for you to give us some parting words, just to give us some incentive to continue on the journey that we're on, whether you're a transplant patient, a PD patient, or a hemodialysis patient.
I think that most people look at the diet and it's such a headache to them. And I just want to say it doesn't have to be. Enjoying food is a part of a good life, in my opinion. There's no reason to not be able to have the foods that you enjoy and that you want to eat, but everything in moderation is important. So even if it's on the no list, you can still enjoy those foods. Just be sure that you're enjoying them in moderation.
Hmm. Hmm.
You
That's
gotta
good
live your
advice.
life. You gotta live
That's
your life.
right. As
Hmm.
my daughter says, life is life, and so we have to continue. Well,
Absolutely.
thank you so very much, and thank you to everyone who joined us today. And stay on Instagram, see what other things we have coming, because we have a plethora of things coming to share with you. And thank you all who enjoyed us, and be safe for the July 4th holiday. Thank you, everybody, for joining, and have a great day.
Thanks. Bye
Bye
bye.
bye.